Our second visitor will be Angela Jackson from the Center for Teaching and Learning. Last year when we hosted this event, Angela was able to participate as well, so we definitely welcome her back for this year's event. So let's give our attention to Angela Jackson.
Thank you. Okay, so I was thinking today about a topic that I would like to present on. It's been quite interesting. It's actually been a subject that has come up through our Center for Teaching and Learning when we work with online faculty who are working in the healthcare setting or within the nursing department. They often ask us, what can we use for web conferencing software that's secure, that's reliable? And so as I was thinking about it, I thought, you know, this is actually a good topic because we actually have a new course rolling out on campus for telehealth. And as we were reviewing the course, obviously we were thinking about what softwares are they really using out there in telehealth and telemedicine. And so I want to share with you some research that we have done on a product that we're actually thinking about adopting here at the university, another product in addition to what we already have. So if you have any questions about anything that I'm talking about today, feel free to email me or you can get in touch with me at that email address. And I also want to share with you today, before we begin, that the products that and the testimonies I'm sharing with you, we don't endorse those. These are ones that I just found on the internet. They are probably one of the best cases. I'm going to share some actual cases with you that's being used, how this product and how the software is being used in the industry, but it doesn't mean we endorse that or we condone that. So I'm just going to share with you some basic information. Here at the University of South Dakota, we use Collaborate Ultra, which we're using today for this presentation, but one of the problems we ran into is it's not HIPAA compliant. So if you were thinking about using this in a telehealth course, or your students were going to be using this to practice with, it probably would be a best choice, especially if they're working with actual patients. Panopto, which is our other option, is not Section 508 compliant. So we're actually looking at using another option called Zoom, which actually solves that problem, both being HIPAA compliant and Section 508 compliant, in that it has built-in captioning capabilities and real-time captioning as well. So it's a really nice, option. We haven't adopted this yet, but we're definitely looking at that. A similar, kind of a little project kind of sparked some interest on campus was one by the university, the School of Education. Dr. David DeYoung did a CTL-funded telepresence project. So basically what he did in this particular project was to basically take an iPad on this type of robot wheel and put it in the classroom and allow what we call a telepresence. So this was kind of the first idea in education which could actually be used in a hospital setting, or it could be used anywhere. This is a remote controlled robot. You control it from the keyboard on your computer distantly, or on your iPhone or your iPad. It's just basically an iPad. It's got a video camera and an audio built into it. It allows for two-way communication with the student or the provider, and it can be used kind of anywhere. So in this particular project, he rolled it out and was using it at a high school in Iowa, which allowed him to be, kind of practice and what that would be like being being the faculty being distant, and then having this interacting with the students, because you can move it around the classroom and you can turn it, and this is really quite neat, and it's all controlled via remotely on your keyboard. So that's kind of another really interesting concept, and you can read more about this at doublerobotics.com, and then I believe Dr. DeYoung also published a paper on this, and we also have a recording in the online faculty orientation course. He did a presentation on this, so you can, if you're an instructor here at the university, you can log in, or I can send you the link to that as well. So spinning off of what we're doing in education, I took a look at what's actually happening out there with virtual telemedicine and telehealth. And this is actually quite exciting, the technology that's out there. And Zoom seems to be one of the pieces of software that's really leading this. They've done a lot of work in the telehealth industry, and they seem to be kind of like the leader in this telemedicine, telehealth, web conferencing, virtual care software. So these are just some benefits. As I was doing the research on this, what I found, which is I think very fascinating, that healthcare professionals can access advanced patient care in rural areas. So basically we can take the physician using this two-way communication interface and put them into the hospital or into the patient's room or into a home healthcare setting. They can actually also have these set up in ambulances, and they work through Verizon Wireless, so that the physician can actually be in the ambulance in difficult situations. The same with the helicopters. If there's a Wi-Fi or a wireless connection, it can work through that as well. The 24/7 support with the clinical level urgency for rural hospitals, we see this across South Dakota. We're a rural state, and getting those specialized physicians there would be sometimes very difficult, and sometimes transporting a patient when they're in a really serious situation can be a matter of minutes or hours away. So I have an example I'll share with you on how that's happening at the clinical level. And then cost savings for skilled physician coverage. So I looked at a couple of examples of how they're using this, how hospitals are actually using this to save money. So instead of having to pay for those skilled physicians being there, and I don't want to just think about physicians, I'm talking about registered nurses or skilled nurses in a particular area. And it also could be used for mental health as well, intervening in a mental health situation. And then real-time lab results shared with physicians. This is really exciting because they've hooked up most of the lab equipment to Zoom, so as they're in the laboratory getting the results, they can share those in real time with the physicians. There's no more waiting. They can actually share what they're actually seeing on the screen with the physician, and they can start making immediate decisions on the care of the patient. And then the face-to-face interaction with the video and with the audio. What was really fascinating, and I'll show you what this looks like and the hardware and how this whole setup looks like in a typical rural hospital, but it was really amazing how using this HD large screen interface on this robotic type stand rolling into the room, how the patients were able to interact as if the physician was right there in the hospital room with them. And they were able to get the care they needed, and they were able to interact with them in a two-way dialogue because there's a camera, on the patient. So there's this nice two-way interaction that's happening in real time. It's pretty neat. Obviously, we have some major considerations whenever you're thinking about a web conferencing software suite for healthcare. Obviously, HIPAA compliance, as I read, was like the biggest thing. Security and privacy is huge, as well as ADA compliance. For example, what would you do if you had a patient who was hearing impaired or visually impaired? How would you be able to interact with them? And then also the consideration of working on major platforms. Should be able to work with mobile devices as well as desktop devices. And then the cost for end user download. Is there a cost supported for that? And then training and support. Excuse me. These are just some global statistics. Pretty impressive numbers, I think, in terms of growth. And then a little bit about what's kind of fueling that growth. So expected high growth in the coming years and advancement in the IT market. So real quick, here's just hopefully this will play. Now for those who are remote, this is a real quick short video. It probably won't pick up the audio, but I put the link here so that if you're connecting remotely, you can watch it remotely.
So I work in IT at Phoenix Children's Hospital, and the best part about it is every day it's something different. Before we had Zoom, video conferencing and communications weren't that great. Other technologies gave us a lot of conflicts, and we spent a lot of time trying to resolve issues for folks. We already have over 220 users. That's 3 times as many as we used to have with other solutions. And the greatest part in IT is we have far less technical calls. When we have a patient who comes in and has some sort of unidentifiable tumor, we have to figure out what it is. So first steps can be exploratory surgery. What we've been able to do is once the patient goes into the surgical suite, the surgeons get their biopsy, and they take that biopsy straight to our pathology team and have it turned into a slide. The pathology team is then able to use a microscope that's hooked up to the internet, view that slide from a web page, and then use Zoom to screen share that slide to any of the consulting physicians that they need to talk to. They're able to do that almost immediately, minutes after this biopsy is taken. So it's limiting time that the kids have to stay under anesthesia, and it's also preventing multiple surgeries. From an IT security standpoint, we love the fact that Zoom encrypts. Zoom provides us a secure connection, physician to physician, nurse to nurse, patient to social services. They can get on, connect, get the information they need, and get back out there and do what they're best at, and that's caring for our patients.
So it's kind of a little on the sales side, but it gives you an idea of, you know, some of the ways in which they're using a Zoom, and I've seen multiple ways, not only in that way, but also using it with counseling. Zoom being used to reach rural areas for counseling as well. So for telehealth use, we've seen it in the virtual patient care workflow, remote patient monitoring, these remote specialist visits in rural areas when the specialists can't get out to patients, and population health management, education, care coordination. Others, ambulatory telehealth with these mobile applications, triage and disaster response, healthcare education, obviously via the Zoom video webinars, hospital administrative meetings, and home health care, actually. I thought that was quite interesting. So just specifically with Zoom, some of the benefits that you get is the simple audio to video and a content sharing platform. It's very similar to Collaborate Ultra, but it offers a few more benefits. And I think one of the really nice things about it is how encrypted and how secure it is if you want to use it in a healthcare setting. And also, it allows this live transcript to not only in Collaborate Ultra, you can record the audio portion. This will actually produce a written transcript. So you'll have the transcript with the audio. So that's quite nice. So here's what an Apple Access card looks like, loaded up with Zoom. So you see it's got the wheels on here with plugins. It's also got diagnostic plugins in it as well. So imagine this being in a patient's room. It's got the video camera on top. It's got two-way audio, allows for direct eye contact. It uses a Mac display, an iMac as you can see here, and it's quite high resolution. That camera can pan, tilt, or zoom in on the patient. It's an omnidirectional microphone, so they can pick up everything that's happening in the room as well. The physician can control the camera, so they can move it up to the patient and zoom in or zoom out if they want to show something to the physician. In the drawer there, it comes with a stethoscope, an otoscope, and an ophthalmoscope, and that connects via a USB cord, so they can actually attach it to the patient, and the remote physician can listen to the heart and lungs remotely, totally crystal clear. It also, I'm sure that you guys have read as well, that they're coming out with other USB devices that allow remote monitoring of patients, blood count and sugar counts and these kinds of things will also be able to be used with this. It runs off of the facility's Wi-Fi connection, and if they lose power, it has a battery. I think that battery there in the bottom can run about 45 minutes without needing to be recharged. And the one thing about this one, though, it's a little bit different than the other one we looked at, is this doesn't have the robotic base on it. But in my, I think because it's just so heavy, so there's like plugins, and there you can see all the big bank of plugins down here, so they can plug other diagnostic machinery into here. But maybe in the future they could make it with a robotic base, and so it could actually be controlled remotely by someone as well. So the example that I'm going to share with you is actually from accessphysicians.com. Have any of you heard of that before? It's one of the leading telemedicine providers, I believe, in the United States. They were kind of like the pioneers of this. This particular cart was designed by their doctors, and they were, from what I understand, one of the first telemedicine certified providers in the United States, and they're operating in Texas. So if this works, so you can click on that link. So this is an actual story from a patient from this care setting.
I was in the hospital because I got a kidney stone, and I got an infection behind that kidney stone, and I was in Hopkins County Memorial Hospital in Sulphur Springs.
We went into the hospital and first saw an emergency room doctor there in Hopkins County, and her blood pressure started to drop pretty significantly. We just couldn't figure out what was wrong with her. And it didn't take very long to transfer over to ICU.
Things kind of began to stall because we really did not know what was wrong. We would get one thing under control and then something else would plummet. It got to the point where the physicians and the medical staff at the hospital had done everything possible for me, but nothing was getting better. And so there was a decision made to bring in access physicians.
If I had to summarize who we are in one sentence, we build scalable clinical programs leveraging telemedicine.
Many patients oftentimes are in need of specific types of care, but oftentimes cannot receive that care due to lack of physician access.
Natalie needed immediate attention from a telepulmonologist because there were several organ systems that were compromised at the time. We specialize in the field of medicine when we are called upon when multiple organ systems are down. When I saw her, her blood pressure was low, she was septic, and so because of the constellation of symptoms that she had, it was the appropriate place for us to come in.
I was nervous. I mean, her life was in jeopardy. I've always had a doctor at my bedside, and that's what I anticipated happening. I was just very impressed with his ability to coordinate the staff. It was very clear who was in charge and what direction they needed to take.
There are moments in your career that you remember every single emotion running through a room. And it's ironic that one of those top moments happened to be when I was practicing medicine through telemedicine. I told her who I was, and I said, we're gonna take care of you. I remember her face and her facial expression, and I could tell she trusted me. And that was a huge thing to me. She was entrusting her life into my hands, and she was comfortable with that decision.
I just remember him having such a calm presence. I just knew that he knew it was best for me and that I was going to be able to rest, and that's what I wanted.
We live in a pretty small town, you know, a small community. The hospital is very good, they do the best they can, but it's limited. And in that moment, we needed some specialty care, and we're able to get that immediately.
It was an extremely rewarding experience at the end, looking back, because I was able to stabilize a patient miles away through this technology that we use.
This is vital to rural communities. We have to have this. It saved my life, and I know that it will save countless others. So I think that this is one of the best things that has happened medically to our community ever. A mother's will to see her kids is one of the strongest things in the world. And I think I got up and walked in like 24 hours. I got to go home, I think 5 days later.
For me, it was a moment of just embracing the moment, not just Natalie, but embracing the moment that we were a part of the whole system in getting her to where she is now.
Dr. Ghosh is my hero. I can never, ever tell him thank you enough for just giving me my life.
So that's just kind of one, I was looking for some other videos to share with you. So basically the one I found that probably shows it in its most, I guess, critical use state. And it brings to thought some ideas on how we might be able to use this in South Dakota and some of our rural communities that don't have access to this, and even in cases where we have, you know, a serious mental health situation, that we can get a skilled person to that person without having to get them in a car and drive them somewhere, that we can actually bring that skill to the patient, and to that person. So that's really all I have. Does anybody have any questions? And I went through it a bit quickly, quicker than I thought I would.
I do. I know that there is a lot of advances in telehealth and increasing access to patients that are in need, but what is falling behind is the legal reimbursement issues. I didn't know if you could speak to that at all, because that seems to be the barrier that's keeping us from moving ahead.
I don't know much, I don't know if you have any thoughts on that. I don't have that kind of, I don't work in that area, so I couldn't really speak to that, but.
Mary Devaney, who's the director of telehealth with Nebraska Medicine, who gave our opening address yesterday, she did speak to that. So reimbursement remains to be an issue, but we also know now that one of the earlier steps that physicians and networks can take is making sure that they are licensed in the state where that particular patient needs help. That's one of the things that they can do, so licensure and certification. But then also making sure that they are networking or collaborating with other healthcare networks in that area, so that if there isn't a particular type of telehealth module available, that we can look at some other options for the patient. And then finally, just making sure that we are following the guidelines for Medicare, Medicaid, and of course those commercial insurance plans. Sometimes not all of the telehealth modules for service delivery will be covered by the reimbursement payment, but we are able to receive reimbursement for some of the other allowances. So we have to make sure that we have people in place who kind of understand the terminology and who understand that maybe we aren't necessarily reimbursed for this function, but we will be reimbursed for all of these functions. And it kind of tells the same story that we do with health promotion. Sometimes we're not able to see a quick return on investment or reimbursement from health promotion, but we know that it works. So sometimes we have to get a little creative with making sure that, you know, other components that we receive the payment for the other components, because we're looking at taking care of the patient from a total aspect.
Well, and then prove that it works, then the reimbursement will catch up with it and go, oh yeah, it does work, so well.
And you know, that happens with so many things. It sometimes seems that the policies and the regulations and of course reimbursements kind of fall just a little bit behind the technology. So I definitely think the industry is at least cognizant of that, and so they're working towards that. But at the same time, the availability of technology is just moving at a great rate of speed. And that's great for getting our patients well, but at the same time, we have to make sure that our providers are compensated.
Right.
Yeah.
Thank you.
Sometimes technology moves faster than we've got all those other things figured out. I know that one of the big discussions right now in education and in health education particularly is this idea of using virtual reality education, especially in nursing. And the issue with that is while the technology is there, we have a problem on the back end. I mean, how do we make this secure? How do we make this, you know, compliant with all these other regulations? And so we have to be really cautious about rolling out something that's new until we really know. I mean, can you imagine if this data got hijacked by somebody? I mean, what it could do. I mean, we're on a Wi-Fi network. It's going all over the hospital. They've got data packets. Could we have somebody that's, you know, in there, you know, trying to retrieve those? So that's one of the reasons I think why Zoom has become more of the industry standard, because they've kind of focused on telehealth and focused on the security